My name is George Verdejo. I'm the Director of Vascular Ultrasound Services at Medical Center in New York City. And today I'll be demonstrating the use of duplex ultrasound to image the arteries from the level of the aortic bifurcation down to the tibial arteries. So we're going to start out today at the level of the aorta. I'm using a curved 5-1 transducer. Although not every examination starts at the level of the aortic bifurcation, for the purposes of this demonstration, I'll start here and then I'll elaborate as we move along. So I got some help from Terry here. Thank you, Terry. Liberal gel is always a good idea. So with the transducer just above the level of the umbilicus, as you can see here, we're going to identify and image the distal aspect of the aorta in a transverse orientation. And I'm just working my way down now toward the feet to identify the aortic bifurcation, as you can see here on the image. There's a little bit of gas there, but I can still see them pretty well. So once I've identified the aorta at this level, what I'm going to do now is turn longitudinal sagittal to the long axis of the vessel here, where I can see, let me just get an arrow here so I can point out my vessels. This is the aorta. This is the left common iliac vein. And then closer to me here, if I can get a good image of it, is my right common iliac artery and left common iliac artery. So here's the right. And we're going to start out by imaging the right common iliac artery. And I'm going to point out some landmarks here. But let's very quickly just acquire a velocity at this level. First, let's turn on the color flow to see what that looks like. Very nice. And you can see here that the color is normal. I'm just going to get the pulse wave Doppler. Let's listen to the signal at this level. Let's get a 60-degree angle in there if we can. Very nice. And we will update to listen. As you can see, that's a nice, normal, multiphasic waveform, and that's what you should expect at the level of the aorta. And it's a good idea to look at the aorta from the level of the renal arteries down to the aortic bifurcation. Once you've done that and made sure that everything is normal, you can work your way down through the iliac arteries. We're going to scan his right iliac artery for the purpose of today's demonstration. So let's take a quick look at that. And what I like to do in general is actually put the color on and very quickly do a scan of the iliac arteries from the level of the aortic bifurcation down to the femoral artery. And so that's what we'll do now. I'm going to actually try to improve this image a little bit. And here we are. Here's the iliac artery. You can see the vein below it. I'm just going to invert so that we can make the arteries red and the veins blue. And what I'm going to try to identify for you now is the first important landmark, and that is the level of the hypogastric artery. And here we are. There really is no external landmark. The landmark really is a sonographic landmark. And here we go. Here is the external iliac artery. This is the hypogastric or internal iliac artery. And here we see the common iliac artery here. Let me just magnify that image a little bit so we can display that just a little bit better. So here we are, and what I'm going to do is work my way back up to the origin of the common iliac artery again, which is not a very long vessel. And let's get a waveform here. You can see that the artery is actually displayed in blue here. We'll invert that and update. And let's listen to that waveform. Very nice waveform. Triphasic is what we would expect it to be. So you can acquire your representative images and spectral waveforms and use the color as a guide to tell you where along the level of the arterial system you have to stop if you suspect an issue based on the color flow or to the image. Again, this is the level of the common iliac artery bifurcation. What I'm going to do is I'm going to work my way down now to the femoral, to the level of the common femoral artery. What I think we're going to do here is just actually freeze this image, because in this particular patient we may be able to image the distal external iliac common femoral artery with a linear array transducer. So let's give it a shot. And that would be my recommendation in most patients. If you can and where you can, use the highest frequency transducer that you have available that will allow you to image the vessels of interest. So what I'm going to do here, and this is an alternate way you can start out your imaging. And what I do actually in most patients, I typically will start out at the level of the groin where I identify the common femoral artery, as you can see here on the image. It's that popliteal vessel. Let's just put the color on, help us identify that even better. Let's increase the scale so that we can eliminate some of that aliasing that we see there. Very nice. So that what you're seeing now is the common femoral artery and the common femoral vein. Now, I'm going to increase the depth here because we're going to be going into the pelvis where the vessel might dive just a little bit and might be a little bit difficult to see. But let's give it a shot. Might require that you have to press a little bit. Here we're looking now at the very proximal common femoral artery. And let's work our way up. In fact, it looks like I don't know that I'll be able to see, but let's give it a shot. Because if we can't, we'll just switch back to the curved transducer. Now again, I'm pushing a little bit and working my way up proximally and making the adjustments with my hand to optimize the image. And there it is. Let's see if we can identify then. There is the common iliac artery bifurcation using this linear array transducer. So in some patients, again, you might be able to get away with using a higher frequency linear array, and we can in this patient. Sometimes it requires a little bit more hand pressure, but if you can, I would recommend that you do that. It allows for better spectral imaging. So let's take a look at the origin of this external iliac artery now with pulse wave. And how can this steer that so that it's parallel to the wall? And then just do a quick update. Let's listen to that. And again, nice, normal waveform, just increasing the gain a little bit. And again, you would want to, after you get a few representative waveforms, freeze it and then acquire your velocities. Let's see, caliper, peak, select, and then end diastole, and the velocity here is 119 centimeters per second with a good normal triphasic waveform. So then using these techniques, I would just work my way down now from the origin of the external iliac artery to the common femoral artery bifurcation. Okay, and again, we use color as a guide to work our way down, allowing the color to tell us where it is we need to stop along the way, if in fact we need to acquire additional velocities where we suspect that there may be stenosis. So here I am, down at the level of the inguinal ligament. I'm just going to steer this color box appropriately. And now what I'm looking for is the femoral artery bifurcation, the common femoral artery bifurcation. Here, just below the level of the inguinal ligament, we see the origin of the deep femoral right here. This would be the superficial femoral artery, and here we have the common femoral artery. Once I've identified that landmark, what I'll do is just slowly work my way back up and then acquire a common femoral artery waveform. And let's see what that looks like. I expect that it'll look normal. I haven't yet identified. Again, nice, normal. In fact, I see 4 phases there, 2 forward and 2 reverse phases, so this is normal. Let's just update this, and again, I'm going to put my color on. You know, one of the important things that you have to do at this level when you get down to the femoral artery bifurcation is always evaluate the origin of the deep femoral artery. Access is always an issue, and in this particular case, what I'm going to do now is I'm going to freeze this image And I'm going to actually just wipe your belly off here, because we won't be needing this part of your anatomy anymore. And I'm going to actually just tuck this towel in here. And I'm going to ask you to just to bend your knee a little bit. Perfect. And with the patient in this position, we actually have access to all of the arteries of interest on the medial side of the leg: the common femoral, the superficial femoral and above knee popliteal, the popliteal artery behind the knee, although if I needed to, I could always turn him on his back or turn him more sideways, the origins of the tibial arteries and the arteries in the foot. To evaluate the anterior tibial artery, what I would do then is just straighten his leg out, and I can evaluate the origins of the anterior tibial artery on the lateral side of the leg. So let's just bend your knee again. Very nice. And I'm going to go back up to the groin now. And let's take a quick look at the origin of your deep femoral artery at this point. And we can see here in a transverse image, this is the common femoral artery and vein. As I work my way down his leg distally, here is the bifurcation of the common femoral artery. There it is. This is the deep femoral. This is the superficial femoral. I'll just turn the transducer then to a long axis. And let's take a quick look at that with color. And that's a very nice image. And let's take a quick look at the origin of the deep femoral artery. And then again, I would caution you always to pay careful attention to the origin of the deep femoral artery. This can be an important vessel in patients with disease, so you always want to take a look at it. If there's going to be an issue with the deep femoral artery, it will probably be at the origin, so always evaluate the origin of the deep femoral artery. And we're getting a nice normal waveform here. Once that's been evaluated, what I would do then is what we call a quick scan in the thigh. And what I like to do is put the color on at this level and then just very quickly evaluate the entirety or the whole length of the superficial femoral artery just using the color flow image. And I think this is a huge time saver because the color flow image, in fact, will give me a good idea about whether or not there is any significant disease along the length of the SFA or in terms of occlusion and stenosis. And in the absence of color flow changes that would make me suspicious, I just scan along the entire length of the leg. I'm just going to freeze this for a second and get a little bit of gel. Again, just pick up where I left off. Allow the color to be my guide, work my way down the leg. As you can see on the ultrasound image here, the vessel is starting to take a dive deep into the musculature at about the distal third of the leg. This is the area where the superficial femoral artery is now referred to as the above knee popliteal artery. So what I'm going to do is just freeze that, and I'm going to show you a nice overlapping technique for evaluating this area. What I like to do is evaluate it from both the medial aspect, this is where I left off, and again, this is above knee popliteal. Sometimes a little pressure from the back will help to push it up and make it just a little bit easier to see. But as you can see, it is kind of moving away from us. What I'll do here is just keep an eye on where it is I left off and then work my way back up the leg from a posterior approach. What I'll do is I'll identify and that was just above knee popliteal artery that I just looked at. I'm just going to turn the color off here, and I just need a little bit of 2D gain. And so what you're looking at here is popliteal vein and artery. There's the vein, it's just disappeared when I push down. And here's the artery. What I'll do is I'll turn long axis now. And from the back of the leg, work my way back up proximally. Posterior approach. Here's my popliteal artery. And you can see here now that I've overlapped both of those areas from both the medial approach and a posterior approach. I'll put the color on and optimize that image. Now sometimes because of the depth at this level and because the angle is not optimal, you can't get a good color flow image, but in this case I'm pretty happy with it. And then again, just continue to work my way down the popliteal artery from this posterior approach. Let's actually steer that color box the opposite way, no, the other way. Very nice. And you can see good color filling. Let's decrease that gain and increase the PRF. And again, I'll work my way down the leg. And what I'm looking for now is to identify the popliteal artery. As you can see now, it's kind of coursing its way up more superficially. I'm looking for the origin of the anterior tibial artery at this point, and I should be able to identify it at about this level. It will be moving away from the transducer, and there it is. You can see that there in blue. Let's get a straight steer on that box. And there is the origin of the anterior tibial artery from this approach. Now, you're not going to see a lot of the anterior tibial artery from here, and that's because of the anatomy. It actually goes through the interosseous membrane and crosses to the other side of the leg. But before we get to the tibial arteries, I do want to talk about what you would conventionally do in the thigh. In the presence of color flow changes that would suggest stenosis and/or occlusion, you should always go back, evaluate those stenoses in terms of elevations and velocity. If you do document occlusions, you want to both locate the occlusions and measure the length of those occlusions in preparation or in anticipation of drawing your arterial maps. So let's go back again. I want to see if I can get a better image of the origin of the anterior tibial artery. Let's see if we can do that in him. Okay, here we go. So a little bit of more of a medial approach here, and what you're seeing in this case is the anterior tibial artery here. This is the tib peroneal trunk. And again, I would also again remind you that you should be acquiring velocities and looking at waveforms at every level along the length of the leg. I'm just going to get this machine a little bit closer to me. Let's go back up to the popliteal and see what the waveform looks like here for a second. And we will invert. Thank you. And let's listen to this. Again, a good normal waveform at that level, which is what we would expect in him. Let's just take a quick listen to the anterior tibial artery, and I think this is important because again, there will be a segment of the anterior tibial artery that won't be visualized, and many times you will have to depend on changes or not in the waveform to tell you about that short area of the anterior tibial that's not seen. So let's take a quick look at the waveform in the anterior tibial artery. As you can see, the vessel's moving away from us. And not quite a 60-degree angle, but that's okay. I'm more interested in the shape of the waveform here than I am in the velocity. So let's just listen to that. And again, it's triphasic. I'm going to freeze that for a second, and I'm going to move out to the lateral aspect of his leg and see if we can identify the anterior tibial artery out here. I'm going to put your leg down, where it comes out of the interosseous membrane and then works its way down the lateral aspect of the leg. And there we are. And let's better identify that by putting the color on. And as you can see, this is the anterior tibial artery on the other side. And then let's take a quick look at that. with Doppler. And invert, and you can see again no changes in the waveform there, and that would tell me that probably there's nothing going on in that short area that we're just not able to visualize because of anatomy. So now what I would do is just continue to follow that anterior tibial artery down the length of his leg from this anterior approach. Let's just go back to the 2D and the color. And let's just steer that as it comes out of the interosseous membrane. And again, you can use the color again as a guide in terms of helping you or allowing you to document stenoses based on the changes in the color flow image. And let's invert this so that's in the appropriate direction. And what I'm doing now is just working my way down the leg, allowing the color to tell me where I need to stop. Slowly, as you're observing changes in the color flow image. And I don't see anything that would signify stenosis. There you go. You can see the further I work my way down the leg, the more superficial the vessel will be. I'm working my way down to the level of the ankle here. And what I'm going to do actually is I'm going to switch, I'm actually going to get lower here, to a higher frequency transducer when I get to the level of the foot. And along the way, by the way, you should be acquiring representative waveforms at what we like to refer to as predetermined sites along the length of the leg, proximal, mid, and distal calf for us. You can see here starting to get very superficial. And I'm going to start, there's actually a point at which it crosses over. Very nice waveform. I'm going to switch transducers now. Actually, before I do that, what I'm going to do is look at the peroneal and the posterior tibial arteries. And let's see how well we can see those. I'm going to ask you to just bend your knee again. And we're going to use a medial approach again to identify. You can actually turn your body a little bit. It'll help you to relax and just rest your knee. Perfect. So again, back to the tib peroneal trunk. And there is the anterior tibial artery again. Here is the tib peroneal trunk. The tibial peroneal trunk will in turn divide where it becomes the peroneal, which will course deeply, and the posterior tibial arteries, which this is the posterior tibial right here. And we'll go back, and this is your peroneal. I'm going to freeze this for a second. That's from a kind of a posterior approach. Let's use a more medial approach and see if we can identify that again from this approach. Sometimes this approach works better. I recommend that you try multiple approaches until you find the one you think works best. And this is a much nicer image in this model. And what you can see here, again, is the tib peroneal trunk, the posterior tibial artery, and then the peroneal artery. So why don't we follow the posterior tibial using the color flow image. Again, color, as you can see, is a very important aspect of this test, which really is an anatomic study more than it is anything else. Although we use all the tools in the toolbox to help us to make our diagnoses, we use the color, we use the spectrum, we use a 2D image. Really what we're trying to do is put together a map that the interventionalist or the vascular surgeon can use in order to determine what type of intervention would be best in a given patient. So again, can we magnify that image just to make it a little bit bigger, make it easier to see? Very nice. Okay, so here's your posterior tibial artery, and you can see the adjacent veins. Let's do Doppler here. Let's just listen to this. And we'll invert that signal. And again, nice normal triphasic waveform. One of the tricks that you can use here, let's just get out a zoom for a second, is if you can't identify, if you're having difficulty identifying the arteries, we're all probably used to scanning the lower extremity veins. And in fact, I didn't mention this, but probably the ideal position, patient position in these patients is reverse Trendelenburg. And the reason for that is because it allows the blood to pool in the veins. And as you can see here, I'm compressing the veins next to the artery. If you can identify the veins, the artery will be right in between there. I'm just going to push down. You can see here that the artery is pulsatile. It's pulsating there. I'm just going to release the pressure, and again, you can see the veins there. For the peroneals, they'll be a little bit deeper. Here are the peroneals. These are your posterior tibials. Here's the peroneal. I'm going to push down again. You can see the veins collapsing around this pulsatile peroneal artery, and that's one of the tricks. The other thing you can do is you can identify there's a groove here that you can palpate with your fingers. If you can find that and just drop your transducer right in there, and then just move your transducer medial and lateral, there is your posterior tibial artery. And let's just put the color on for a second so we can show you that. Can we make that box just a little bit bigger? Because I want to see if I can show them the posterior tibial and the peroneals in one picture. And maybe let's steer it a little straighter. Good. So there's your posterior tibial artery, and let's see if I can increase the color gain and show you the peroneal. There's the peroneal at the very bottom. I'm going to push down a little bit. There it is. So what you're seeing here is your peroneal artery and your posterior tibial artery in one image. So again, identify that groove in the leg, drop the transducer right in there and rock it back and forth medial to lateral until you identify the vessels of interest. And then the other way that you can do it is by using the bony landmarks. If you turn transversely, here at the top of your skin is your tibia, and this is your fibula. If you look medial to the tibia, you should be able to identify your posterior tibial artery and veins. There they are again. I'm just going to push down and show you that compression right here. And here by your fibula will be your peroneal arteries, artery and veins right in here. Vein, artery, vein. As I push down, you can see that the veins collapse. The artery is pulsatile. And of course, ultimately, you can always use the color, although keep in mind that in patients with multi-level occlusive disease and with these low flow states, the color may not be very helpful, so the other landmarks might be a little better in terms of identifying the artery. So here they go again. Is your peroneal below or in the far field, and your posterior tibial artery in the near field. And again, you would want to use your color flow image to evaluate the entire length of the posterior tibial and peroneal arteries down to the level of the foot. Now what I'm going to do is I'm going to switch over to a higher frequency transducer to evaluate those vessels in the foot where they tend to be more superficial. And so am I using the 12.5? Thank you very much. Okay, so since we have the patient in this position now, why don't we just evaluate the posterior tibial artery. You can always palpate, if you need to, a posterior tibial artery pulse. But in most patients, if you're mapping them, the posterior tibial artery pulse probably won't be appreciated. So let's just medial to the medial malleolus. You can identify the posterior tibial artery and veins, as you can see on the ultrasound image. Let's put the color on and see what that looks like. And maybe, why don't we zoom that a little bit just to make it a little bit easier to see. You can see that the vessel is relatively superficial and smaller in caliber at this level, but is very easily identified on the color flow image. And you can see the veins adjacent to that. I'm just going to turn transverse for a second and show you what it looks like transversely. Let's just turn the color off for a second. So again, if you're having trouble, transverse image, you can push down, the veins disappear, and there's your artery. And this is the malleolus here. So once you've identified that image, again, you can turn long axis and put your color on, and then follow that vessel back up as far proximally as you need to in order to assure that you've evaluated the entire length of the posterior tibial artery, and that's a great image there of the posterior tibial artery. And again, acquiring all the velocity and waveform data that's necessary to complete your study. As you can see here, I'm working my way up the leg to the level just where I left off with the lower frequency transducer. And then you can just take that again right back into the foot as far as you need to. Let me actually invert this to make the artery red. And let's increase the scale. Good. And I'll just work my way into the foot as far as I can, making the adjustments with the color flow box as I do that. You can see now that the vessel is kind of moving away from us as it works its way into the deeper part of the foot here. This is your very distal posterior tibial artery and veins. Let's listen to see what that sounds like at this level. Okay. Let's just decrease that scale and increase the gain a bit. Very nice. Nice normal waveform at this level. Let's take a quick look at the anterior tibial artery as it crosses the extensor crease and becomes the dorsalis pedis. I'm just going to ask you to straighten out your leg a little bit. And one of the mistakes I see quite often is that the technologist or the sonographer will try to scan the dorsalis pedis artery with the foot in plantar, severe plantar flexion. In a patient with low flow states, this could actually compress the dorsalis pedis artery and make it appear as if there is no flow, as if the vessel is occluded. So I would just make sure the patient is dorsiflex, very little pressure, and lots of gel. And then identify the anterior tibial artery as it crosses over and becomes the dorsalis pedis artery. And let's put the color flow on. Okay, and there's your dorsalis pedis artery. And again, very little pressure here. And let's just increase the gain a little bit. Very nice. And there's your dorsalis pedis artery. I'm actually going to move proximally a little bit, and there it is. So this is the dorsalis pedis artery. You know what I want you to do for a second? Do this with your foot, plantar flex, and let's see if anything happens in terms of the compression here. In this case, not so much. Although, again, in patients with low flow states, you have to be very careful about compressing and occluding the vessel at this level. You can go normal position again. And so, again, you just follow this into the foot as far as possible and acquire all of the appropriate waveforms and blood flow velocities. And let's take a quick listen to the dorsalis pedis artery here and see what it sounds like. As you can see, it's a triphasic waveform in this normal patient. So that's the evaluation of the patient with suspected peripheral arterial occlusive disease. It's essentially a straightforward technique. Of course, it's much more straightforward in this patient who doesn't have any disease at all. Can be quite challenging in patients with multi-level occlusive disease, but if you use the techniques that we described, I think you'll be able to facilitate a complete examination. I wish you all lots of luck, and if you need to send me an email or have any questions, feel free to do that. My email address is gb, those are my initials, and my credential, RVT, so it's gbrvt@aol.com. Good luck.